Air pollution, the silent health threat. What is air pollution? Air pollution refers to the presence of harmful substances in the air we breathe. These pollutants may come from man-made sources like vehicles, factories, and burning of fossil fuels, or from natural sources like dust storms and wildfires. Air pollution can weaken the immune system, making individuals more vulnerable to infections and allergic reactions. Pollution has numerous detrimental effects on human health, impacting respiratory, cardiovascular, and neurological systems, among others. It can lead to respiratory diseases like asthma and COPD, cardiovascular problems, and even neurological disorders. Long-term exposure can increase the risk of lung cancer, heart attacks, and strokes, as well as contribute to cognitive decline and reproductive issues. Here are 10 effects of air pollution on human health. 1. Respiratory illnesses. Air pollution, especially particulate matter, can irritate the airways, causing or worsening conditions like asthma, bronchitis, and COPD. It can also lead to reduced lung function and increased susceptibility to respiratory infections. 2. Cardiovascular disease. Air pollution can damage blood vessels, increase blood pressure, and contribute to the formation of blood clots, increasing the risk of heart attacks, strokes, and other cardiovascular problems. 3. Neurological disorders. Exposure to air pollution, particularly fine particulate matter, has been linked to neurological issues such as cognitive decline, memory problems, and neurodegenerative diseases like Alzheimer's and Parkinson's. 4. Cancer. Air pollution, especially particulate matter and certain carcinogenic compounds, can increase the risk of lung cancer and other types of cancer. 5. Skin damage. Airborne pollutants can irritate the skin, exacerbate skin conditions like eczema, and contribute to premature aging, wrinkles, and potentially skin cancer. 6. Reproductive issues. Studies suggest that air pollution may affect reproductive health, potentially impacting fertility, menstrual cycles, and pregnancy outcomes. 7. Developmental problems. Exposure to air pollution during pregnancy can affect fetal development, potentially leading to low birth weight, stunted lung development in children, and increased susceptibility to infections. 8. Immune system dysfunction. Air pollution can weaken the immune system, making individuals more vulnerable to infections and allergic reactions. 9. Mental health impacts. Research suggests a link between air pollution and mental health issues, including anxiety and depression. 10. Increased mortality. Long-term exposure to high levels of air pollution significantly increases the risk of premature death, particularly from cardiovascular and respiratory diseases. Causes of air pollution. Vehicle emissions, especially from diesel-powered cars, motorcycles, and trucks. Industrial discharge. Factories release smoke, chemicals, and metal particles into the air. Burning of fossil fuels, coal, petrol, diesel, kerosene, and firewood produce carbon-based pollutants. Open burning of waste. Trash burning, especially plastics, releases toxic gases. Construction dust. Large construction projects release fine particulate matter, PM2.5 and PM10. Indoor air pollutants. Use of biomass fuels, kerosene lamps, tobacco smoke, and poor ventilation. Agricultural practices. Burning of crop residues, common in South Asia, and pesticide spraying. Natural contributors. Dust storms, wildfires, volcanic eruptions, less frequent but impactful. Health effects of air pollution. Air pollution harms every system in the human body, but especially the lungs, heart, and brain. 1. Respiratory system. Aggravates asthma and chronic bronchitis. Triggers frequent coughing, wheezing, and throat irritation. Increases lung infections like pneumonia. Reduces lung function, especially in children. Linked to lung cancer from long-term exposure. 2. Cardiovascular system. Causes high blood pressure, hypertension. Increases risk of heart attacks and strokes. Promotes buildup of fatty plaques in blood vessels, atherosclerosis. Worsens heart failure in those with pre-existing disease. 3. Other effects. Increases risk of diabetes. Reduces birth weight, causes premature births. Affects brain development in children. Contributes to dementia and cognitive decline in older adults. Weakens immune system response. How it affects all ages. Infants and children developing lungs are more sensitive. Exposure can impair growth, learning, and immunity. Teenagers, reduced stamina, higher asthma risk, and allergy development. Adults, workplace exposure increases risk of chronic illness and reduces productivity. Elderly, more likely to die from heart and lung complications triggered by air pollution. Pregnant women, air pollution is linked to miscarriage, low birth weight, and developmental delays in babies. Risk factors that worsen the impact. Living near highways, factories, or dump sites. Using firewood or kerosene for cooking indoors. Smoking or exposure to secondhand smoke. Pre-existing asthma, heart disease, or diabetes. Poor nutrition, low antioxidants and vitamins. High-stress environments weakens immunity. Lack of healthcare access and poor housing. Prevention and control strategies. At the individual and family level. Use clean cooking methods, LPG, electric stoves. Avoid smoking indoors. Promote smoke-free homes. Install indoor air purifiers or use air filtering plants. Stay indoors on days with high pollution, monitor AQI apps. Use N95 masks in polluted areas. Encourage tree planting around the home and community. At the community level. Ban open waste burning. Promote carpooling, cycling, and use of public transport. Organize clean-up drives and awareness walks. Monitor air quality and pressure local leaders to act. At the government or policy level. Enforce strict vehicle emission standards. Regulate industrial emissions with penalties for violations. Shift to renewable energy sources like solar and wind. Encourage green urban planning and more green spaces. Introduce clean fuel subsidies for low-income households. Implement early warning systems during high AQI days. Action plan for sustainable control. Raise awareness in schools, religious centers, and markets about air pollution and health. Advocate for clean cooking. Energy in rural and peri-urban areas through NGOs and public health agencies. Integrate air pollution education into routine medical counseling for heart and lung disease patients. Push for legislation that mandates green zones in urban planning. Engage community health workers to distribute masks and demonstrate indoor air control methods. Track local air quality and provide daily public health advisories on radio, WhatsApp, and social media. Encourage research and innovation on local, low-cost air purifiers and pollution mapping. Conclusion. Air pollution is more than an environmental issue. It's a public health emergency, affecting every organ, every person, and every stage of life. While governments must act boldly with regulations, individuals and communities must also take responsibility through cleaner choices, awareness, and advocacy.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.